Hello all, this is Dr. Dheeraj Masapu. I'm a senior consultant in the field of neuroanesthesiology. So today we have Dr. Lily Samcherian. Welcome to the channel, Dr. Lily Samcherian.
Thank you, sir.
So today we are going to review the DNB colleges or hospitals in Kerala. So that is the agenda behind this particular video. So we are trying to help the students who are going to counseling for NEET PG session this year. So that is the agenda behind. So before going into the video, I would like to ask your story of how you actually decided to do anesthesia and which college and how you ended up in Bangalore. So what is the total story?
Yeah. So I am from Kerala. I did my UG from JSS Mysore. So after that, I wanted actually my first option was anesthesia, second was ophthal. I know it's like two entirely different field. So then my counseling was during the start of COVID. So I had researched about anesthesia hospitals all over India. So then I got into Pune Hospital and Research Center. There I chose anesthesia. So now it's been like 1 year post my PG. Now I am currently working at Bangalore at Ramaya Medical College. So it's been about 5-6 months.
So how was Bangalore?
Bangalore's nice, sir. I've been here for my NEET PG preparation, and my friends and few families also here. So I've decided to stay back in Bangalore.
Super, super. Like me only. I am from Andhra Pradesh, but we chose to settle in
Oh,
Bangalore.
yes, sir.
So then we'll go into the
Yeah.
I'll just share the document. Hospitals in Kerala. I have the list in front of me. I think you guys can see. So we'll start with Anantapuri Hospital and Research Institute.
Yeah,
So
so
what is your opinion, Doctor?
it's in Trivandrum. So
Yeah.
Anandpuri has a good review in anesthesia, even general surgery and emergency medicine. They have a good review.
Okay.
And general medicine is also it's on the list, but I haven't gotten to talk to any particular resident in general surgery. But all the other branches they are good. And neurosurgery, critical care medicine, I have not spoken to anyone in neuro and
No
critical
problem.
care.
Then it must
Yeah.
be above average center only, according to you. Correct me.
Yeah, they have all the departments, so it's a huge hospital. So caseload wise and exposure wise will be good, but in detail about academics and that is a problem with DNB hospitals. So that I am not very sure of. But otherwise, all the departments are there, so it is okay, sir.
Academics nowadays, actually, there are so many, online programs. For anesthesia, though, there is a
Yeah,
Marrow.
anesthesia. Yeah, ISA Kerala. That.
ISA Kerala is there,
Yeah, yeah.
Marrow, and so many are there actually.
There are so many. Yeah, yeah.
I think we have to
So
go.
yeah, and if, academics wise, basically YouTube there are online sources, so that won't be a problem.
Yeah, bedside
Then
teaching is the problem if they're not there.
bedside teaching, yeah, bedside teaching and surgical field hands-on that can be a problem, but I think that is a problem in medical colleges also some in some
Surgical
places.
specialties, MS general surgery is the best, or MS
Yeah.
or whatever.
Yes, yeah, yeah. That's the review when I've gotten around the surgical side. Better to choose MS because only few places they have hands-on or they let you as wash for the case.
Correct.
Yeah. Then we'll move on to Aster MedCity, sir.
Yeah.
Apollo Adlex, I am not very sure. Aster MedCity. So Aster MedCity anesthesia is really good, and it's a very huge hospital. So they have all the department, interventional cardio, interventional radio, everything they have.
Okay.
So almost all the field, especially anesthesia, is really good. General surgery also, it is good.
Okay.
Yeah.
It's a pretty famous hospital.
It's a very like it's one of the main referral center also. So they do get like so they don't refer any cases. Whatever comes, they take it. So it is a big center. So you get good hands-on, good exposure.
Yeah, this has been one of the initial Aster hospitals. Actually, I work in Aster
Hmm.
Whitefield.
Oh
So,
yeah, Whitefield. Uh-huh.
so this is one of the initial Asters. Aster actually started, I think, in Kochi. So it is, I think, the flagship hospital or mostly that is the initial ones. And the neurosurgery, though, I know they do a good quality work. They do a lot of brain tumor.
It's a very busy center actually.
Yeah.
And the place also, Kochi, it's good for the residents to live in also, I feel.
So Kochi is a good place, huh?
Kochi is a good place for residency to stay. Kochi, Calicut, even Trivandrum, those places are actually good in regards to facilities to have a life outside the hospital, I guess.
No, no, here I have one question. What about learning Malayalam? Because Malayalam is very tough.
Yeah, that is a problem. The problem with Kerala is people only know Malayalam or English. Hindi also, it's a bit difficult. So I think you will end up learning Malayalam, I guess.
Like how you
Or at least whatever is related to take a case, to interact with the patients. And there are sisters, brothers, everybody will be there to help you out also. But patient interaction field, yes, language. If you can learn the language, it is okay. Like I've learned Kannada, a bit of Marathi when I was in Pune, like whatever is required for the OT. But as I said, anesthesia patient interaction is less compared to medicine, surgery, or other fields. So
But
that
there is
depends on persons.
But if you are in ICU, you need to interact and take history and all.
Yeah, you would need to explain everything. So that that can be a problem for a few
Even anesthesia
people, I
also. I
guess.
think maybe radiology and the other microbiology and all that in Aster Medcity, language wouldn't be a problem. Yeah, got
Yes,
it.
sir. Yeah.
Yeah. Next.
So Baby Memorial Hospital, Calicut, it's in Calicut, North Kerala. So that has a very good review. General surgery is good. So actually, for general surgery, MIMS, Baby Memorial, there are few other hospitals. I'll tell you. So this is one of the very good center for general surgery.
Okay.
Even anesthesia is really good, and ortho is also good.
Got it.
And emergency medicine is also fine, sir.
Oh, super.
Yeah. And it's a very huge center, very busy center.
Kozhikode
you get
places, even
Kozhikode is Calicut. Yeah, Kozhikode is Calicut.
Calicut. Calicut is a big. So not.
Yeah, Calicut is a big.
All these places have the flight connectivity, I think, so direct.
Calicut has an airport, but it's a bit far from Baby Memorial, but you can move around.
Got it. Okay.
Yeah, and the place as such is also a good place. You like there are a lot of options for food. Actually, it's famous for.
What is the famous food there?
You get chicken biryani is a most famous. And you get a variety of food, so that life won't be a problem there. Believers Church is actually a medical college. So I have only inquired about anesthesia there, like to work. So I guess critical care will be good in Believers, but I haven't spoken to anyone about it. But since it's a medical college, so it might be good. But critical care anyway, sir, it's a NEET SS, no?
Yeah, NEET SS. We don't have to discuss.
All this are super specialty branches, no?
Yes.
Bharat Hospital. Caritas, sir. Bharat, I don't know.
Caritas.
Next, Caritas Hospital. That's in Kottayam. It's like south of Kerala.
Okay.
So in Caritas, general surgery, I had spoken to one of the resident there. So sorry, so general medicine. So general medicine, it's actually good at saying.